The Oraya therapy is an innovative treatment for wet age-related macular degeneration. The Oraya IRay system is a stereotactic radiotherapy device that delivers low-energy X-rays to inhibit and prevent the choroidal neovascularization associated with wet AMD. There is evidence to suggest that ionizing radiation has an anti-angiogenic and anti-inflammatory effect in conditions such as choroidal neovascularization. The proprietary eye guide lens is positioned by the physician. The lens is aligned to be concentric with the limbus, facilitated by tracking software. A gentle vacuum ensures eye guide coupling to the sclera, allowing eye stabilization and manipulation by the physician. When accurately positioned, the center eye guide post represents the patient's optical axis. The eye's orientation is adjusted to establish accurate alignment between the patient's optical axis and the IRay system. The X-ray beams are directed to a position temporal and inferior to the posterior pole of the optical axis. This shift targets the X-ray beams onto the fovea. A low-power aiming laser is used to perform a check which ensures that the iris and the lower eyelid are not in the path of the X-ray beams. The X-ray therapy is applied using 3 beams, a center beam and 2 additional beams 30 degrees to either side. Each X-ray beam measures approximately 3.5 millimeters in diameter at the sclera. The beams are accurately positioned to pass through the pars plana, avoiding the crystalline lens. The X-ray tube is precisely moved to deliver the beams to the targeted region. The 3 beams are applied sequentially and are approximately 4 millimeters in diameter where they converge on the macula. Radiation exposure to the optic nerve is minimized. The X-ray beams diverge after passing through the retina. The residual radiation is largely absorbed by the bones of the posterior orbit, which are relatively radioresistant. Minimal doses of radiation are deposited to areas outside of the targeted foveal zone, and the patient receives a total body effective dose that is comparable to 1/10 of a head CT scan. Following the radiotherapy treatment, the eye guide is disengaged. The patient is able to leave at the conclusion of the procedure with routine follow-up. The Oraya therapy is rapid, easy, and comfortable for the patient, and offers a non-invasive one-time treatment for patients with wet AMD.